Okay. He's a bit agitated, isn't he?
He was doing something around this thing.
This one?
Yeah.
When the ladder slipped, the saw ripped through his abdomen.
I think I broke my bone! Ow! Ow! Ow!
13 minutes after they were called, Will and Colin arrive on scene to be briefed by the ambulance crew.
All right, thanks. My name's Will.
Has been working on a building site, ground floor, just across the road from here. He's been using a plunge saw. Thought he had it all stable and reached underneath it, but it's still been going. It's dropped and gone through his arm.
Okay.
We've just got quite a deep laceration to the right forearm there.
Righto.
The blade has sliced open a deep 3-inch wide wound.
Have a clean bandage as well. Clean cut. Went quite grey. Was quite shocked from everything that happened originally. Had his legs raised on our arrival.
Rich was working alone when the mechanical saw caught in his coat and sliced through his arm. He ran outside to get help before collapsing unconscious in the street.
Got my first set of obs done now. Just got him inside because it was so cold, really.
Lovely,
so,
lovely.
Quite deep.
I think we have gone through some tendons or ligaments there, haven't we? But not much in the way of blood loss.
We're unsure. The towel that was wrapped round him disappeared once we were getting there. There was some blood in his left glove, so we're not sure exactly. There's no blood loss through the floor either.
Oh, well done.
If the blade has cut through muscles and tendons, there's a chance Rich could lose the use of his arm.
Do you think there is tendon damage?
It looks like it.
Have you got a good sensation in all your fingers?
Yeah, I can feel them all.
Can you move them well?
Pins and needles.
Do you feel like your grip is weak?
Last year, there were 54,000 injuries on building sites.
Do you feel sick at all?
A little bit.
A little. Close.
This is a 26-year-old chap who is working on a construction site with what he calls a plunge saw.
Will phones control to update them on Rich's condition and discuss which hospital he should be sent to.
This saw has come down onto his the inside of his right forearm and he sustained an isolated open laceration. It's quite deep. There's a lot of stiff adipose tissue and it looks like there's possible tendon and ligament damage there as well. As he was sort of moving, you could see stuff moving in the forearm, if you know what I mean. We'll go with QE as his destination.
Rich's arm urgently needs to be assessed by a plastic surgeon, which means he will be blue lighted to the Queen Elizabeth Hospital Major Trauma Centre in Birmingham.
There was no sort of foreign bodies, debris or anything. It wasn't dirty, was it? It did look clean, didn't it? Yeah.
Rich's blood pressure and heart rate are returning to normal, so the ambulance crew can give him some pain relief with less risk of him passing out.
What we might do then is pop a little cannula in your arm, give you some paracetamol that way.
How much pain are you in?
Well, it's getting worse as it's go, like as I'm calming down a bit.
Yeah. If you had to give the pain you're in a score, a mark out of 10, 10 being the worst pain.
I'd say maybe about a 6 or 7.
Oh.
22 minutes after they arrived on scene, Rich is ready to start the 5-mile journey to hospital.
Get that arm sorted, right?
Yes, guys, thank you for your help.
Well, there you go.
Take care. Get well soon.
Satisfied with his progress, Will and Colin are happy to leave him in the care of the ambulance crew. A man is lying crushed beneath 1/4 ton of cast iron. The range of potential injuries are so severe, the critical care team have been scrambled. Helimed is above the house within minutes. Matt and Karen are concerned the longer the man is trapped under the machinery, the more damage is being done.
If they've managed to get it off quite quickly, then we'll be looking at some soft tissue damage and fractures. If it's stayed on his legs, how long it's crushed his legs for, because then you get problems with circulation.
Hello.
How are we doing? You all right?
Says you can feel it, obviously it hurts.
Yeah.
Arriving on scene, Matt and Karen are quickly briefed by the fire service and a local ambulance crew before they can take control of the rescue.
He has got a collis fracture on his left wrist as well.
Okay.
So we're just in the process of getting the engine off.
Okay. What's your name, fella?
Dave.
Dave. My name's Matt, one of the doctors off their ambulance. All right.
Scrapyard manager and Land Rover enthusiast Dave Evans was renovating one of his old vehicles when the heaviest part, the engine block, fell off the workbench.
Can we get you back on this gas and air?
Dave tried to stop the fall, but the huge weight was too much, breaking the bones in his wrist.
And it's just toppled over onto him from there, has it? Presumably.
The ambulance crew have splinted Dave's broken wrist and given him gas and air and intravenous morphine to help him deal with the pain.
How's he doing with the morphine?
Although Dave appears calm, Karen is worried about the potential injuries to his leg that they can't see.
Is it from the lower leg?
What I can only see just around the knee, I can't see below.
Has he got a distal sensation?
Karen is worried the engine could be restricting the blood supply down his leg. This could lead to Dave losing his foot. It's essential they get the weight off before it's too late. Every second counts, because without proper circulation, there's a real risk that the leg won't recover and it will have to be amputated.
The leg can just go ischemic. You cut off the oxygen supply and then that builds up toxins. And then, of course, when it's released, those toxins can then go into the main circulation.
The fire brigade are trying to free Dave using hydraulic lifting equipment, but without a clear view of his trapped leg, it's hard to get the machinery into the correct position without risking even more traumatic injuries.
Right, that's it. Really slow, deep breaths now.
He's had 15 milligrams of morphine and continues to take gas and air to deal with the intense pain.
Right, let me hold it. Good man, that's it. And again. Deep breaths.
With the lift now in position, the firefighters and medics work together.
Good. Deep breaths, Chris. What's supposed to do this, mate? Go on.
Right, sorry.
Deep breaths, I say, well done.
Oh! Hang on.
Hold there, Chris. Just hold it there.
You're going to help yourself, though, would you, right? Go on, forward. Okay. Go on, forward. We shoot.
Smash it.
Go on. Go on.
Well done.
There we go.
With Dave's leg finally free, Matt and Karen can assess how badly it's been damaged.
Good man, let's have a little look at it.
How's your pain now that you've come out?
Just a bit, because my foot's been pushed, but I don't feel like it's broke. My wrist is definitely.
Yeah. Are you tolerating the pain at the moment?
Yeah.
That's a lot better.
My leg feels
All right.
fine.
Good.
Very good.
Toes a bit blue.
Give your toes a wiggle. Good man. Well done.
Miraculously, despite being trapped under a quarter of a ton of cast iron, Dave appears to have escaped with just some painful bruising.
Shall we get your chair, do you think? Yeah. We'll pop him in a chair and go over the back.
She gets to shout at you now you're all right.
You'll just have to do it in the house next time, won't you, where it's dry? Be all right. He's been very lucky. It's just sort of pinned his leg to the floor. He's got no serious injuries. People can come off much worse if he'd fallen on his femur, his pelvis, his abdomen, his chest. You know, his injuries could have been far more significant.
Dave is being taken to hospital by the ambulance crew, leaving Matt and Karen clear to respond to the next emergency.
It looks like a 43-year-old male who sustained an abdominal injury from a chainsaw, and his intestines are out on the floor.
An ambulance is already on scene, but the man's injuries are so severe that they've requested critical care backup. Tom has been dispatched.
It's easy to paint a picture, but you really don't know until you get there.
11 minutes after receiving the call, Tom arrives at the address. His body cam records every detail of the horrific scene.
Hi, you right? Hello, sir. My name's Tom from the air ambulance. What's your name?
The injured man, 43-year-old forklift driver Rafa, is being given oxygen by the ambulance crew to try and keep him conscious as his body reacts to the shock of the 5-inch wound to his lower abdomen.
Right, so with this, if you just want to cover that with that. Perfect.
I'm just taking a photo of it.
No, that's fine.
Just in case you
Right then. That doesn't look too bad.
It looks like it's adipose tissue more
Yeah.
than anything, doesn't it?
The blade has sliced down through skin and flesh, exposing his intestines.
Oh.
Tom needs to try and keep the wound clean, prevent his intestines coming out, and stop the bleeding.
Hopefully, if we can just hold it around it, it will stick to it a little bit. And then, if I can get you guys to put some tape around that, is that all right?
Just going to stick the dressing down, Raphael, OK, just to keep it clean.
OK, so this gentleman, age, I believe you already know. He's a GCS of 15 at the moment with isolated abdominal injury with partly eviscerated bow.
With such a deep wound, Tom knows Rafa could have catastrophic internal bleeding. He needs to get him to hospital fast for emergency surgery.
I think my initial plan would be to get some IV access, wound management, and then convey him to the QE.
The danger is that moving him may put too much strain on him and send him into cardiac arrest.
How are you feeling? Sam, can you get some IV access? Is that
Operation, yeah?
Yes, he will need to. Right, we're going to cut this off.
It isn't safe to move Rafa until Tom knows the full extent of his injuries.
Just put him forward. I just want to check his back while we're here. Yeah. It's very sweaty, isn't it? OK, so no other injuries. Was this done on a chainsaw?
Yes.
Can you find out exactly what's happened?
The gentleman there speaks English.
How are you feeling?
He went on a ladder. He was doing something around this thing.
Yeah.
And yeah.
It turns out Rafa was fixing the guttering with an electric saw.
This one?
Yeah.
When the ladder slipped, the saw ripped through his abdomen.
Yeah, 6'2", just an update. So heart rate's around 50 at the moment.
Rafa's blood pressure is low, which could be a sign that the blade has damaged some large blood vessels internally or even perforated the bowel.
He's quite clammy and sweaty at the moment. I see no immediate signs of him hemorrhaging, however, I don't know how deep it is.
They have to get him to hospital.
I'm going to get him in the back of the ambulance and convey QE. I'll put some details as we go. OK then, Rafa, we're going to put our chair here. We're going to get you to move you and take you into the back of the ambulance, OK? My only concern is he's a bit hypotensive, so he might go a bit funny if we stand up. So we're trying, obviously, avoid as little movement as possible. Hold on to my hand. OK. Do you feel like you can walk? No. OK, that's great. Are you sure? OK.
Despite Rafa's horrific injuries, Tom has no choice but to move him onto the ambulance.
Yeah.
Keeping the pressure on the wound to stop his intestines spilling out.
I'm just a bit worried he's a bit hypotensive, so we'll just take our time. Well done. OK, so up you come. So, at the moment, this gentleman's got a circular saw accident to his stomach, part of his bowel, and a lot of his stomach is out at the moment, so we've addressed it. We're going to give him some drugs to stop him bleeding and pain relief and take him to the major trauma hospital in Birmingham.
Just going to give you some pain relief, some paracetamol, OK, to help with your pain, Rafa.
How are you feeling? Yeah?
They head to the major trauma centre at the Queen Elizabeth Hospital, where Rafa will need immediate surgery to repair the wound and stop any internal bleeding.
Rafa, are you all right holding that?
On the journey, Tom needs to keep his patient under close observation. There's a real danger his low blood pressure could suddenly drop, putting him into cardiac arrest.
Rafa, how are you feeling? All right? Good. Well done. You're doing a great job. We're nearly there.
Arriving at hospital 23 minutes later, Tom can hand over his critically injured but now stable patient to the waiting specialists.
Thank you.
(6'2" at scene.
Once on scene, Pete is briefed by the ambulance crew.
Hi guys.
Hi.
How are we doing?
Helmet came off in the crash.
Has he been speaking to us?
Not at all. We've been like this since we got it.
Okay.
21-year-old Curtis has been thrown from his motorbike after colliding with a car. In the impact, his helmet came off before his head hit the road.
Okay. He's a bit agitated, isn't he?
Curtis has a severe head wound.
It's quite common when we get this sort of patient, big head injuries, start getting agitated. It's not intentional, he doesn't know what he's doing, he's got a really reduced level of consciousness. Has he got a radial pulse? Yeah. Okay, let's see if he'll tolerate an oxygen mask, all right? Let's pull his stuff out. Yeah, that's it. We'll see if we can get him onto the scoop as best we can. His GCS, his eyes are open.
To try and evaluate him, Pete uses the GCS, or Glasgow Coma Scale.
Mate, can you hear us?
Usual hazard zone C.
A scoring system that helps describe the level of consciousness. A normal score for speech is 5.
Verbally, he's probably a 2, isn't he?
Further indication that Curtis may have a traumatic brain injury.
We want to protect his brain, and by taking over his ventilation and us doing it instead of him, we can protect his brain and stop it swelling, hopefully. That means putting him into an induced coma.
Breathing automatically with a ventilator will allow Curtis's brain time to rest, calming the swelling. But an induced coma is a risky procedure, usually only carried out in hospital.
Are we treating it as life-threatening this time?
I would say it's got the potential for that, yeah. Let's just try and keep him as still as we can, all right?
The impact dislodged his helmet, and he now has a suspected brain injury.
Pop his legs onto there. We'll get him on the stretcher. I think he's a bit hypertensive because I can't feel a radial pulse.
Curtis's condition is so serious that he needs a trauma doctor to put him into a coma to protect his brain. But the air ambulance carrying one is still 8 minutes away.
I think the priority, right, if we can get him on the back of the vehicle and we can do a proper assessment on him, we'll get some access.
Curtis is losing blood from his head, but his weak pulse indicates internal bleeding too.
We'll get full monitoring on him. We'll see what his BP is. I suspect his BP might be low, so it may be that he needs some TXA, all right. But if we could get some head blocks on just to keep his head still, all right.
So you've got IV access, then?
Nice one, all right. Is that the TXA, is it? Yeah.
Pete needs to give Curtis tranexamic acid, or TXA, which helps prevent excessive blood loss.
Let's get full monitoring on him if we can, and let's see what his observations are. Let's cut his trousers off and get that skin to skin. All right.
The doctor on board the air ambulance is now just moments away, but Curtis is deteriorating by the second.
Is he breathing?
Yeah.
His respiratory is very shallow. It's obviously quite poorly. Let's get an airway in him if we can. What we might need is a BVM as well once we've got that. So let's get that eye gel in first.
29 minutes after the 999 call, the Midlands Air Ambulance arrives with critical care paramedic Ryan James and trauma doctor Ben Taylor.
He's collided with that car, or the car's collided with him. It's thrown him off, his helmet's come off in the impact. He's got a big head injury. He's been spontaneously breathing, although he's very shallow. I'm setting up for RSI.
I'll leave you set up, carry
yeah.
I'll assist.
All right, yes please, yeah. Is that all right?
Yeah, sort of drugs out.
Yeah. He's had some TXA due to mechanism. Yeah, I've drawn some ketamine off. There's 160 left there, Ben, because he's had 40 out my 200.
The critical care team use a range of powerful anaesthetics, like ketamine, not carried by ambulance crews. They can also perform procedures normally only done in hospital.
Going to give an anaesthetic just to protect his brain and give him the best possible chance of recovering from his injuries.
Putting Curtis into an induced coma might give his brain precious time to recuperate and encourage any dangerous swelling inside his skull to subside.
So plan to the RSI within the next 5 minutes.
To place Curtis into a coma, he first requires RSI, rapid sequence induction, an advanced critical care respiration procedure that Pete decides is safest to do outside the ambulance.
Because the process is quite risky, we need to have 360-degree access. So if the patient starts to deteriorate for any reason or we're having difficulty with the airway, we've got good access and we're not sort of fighting over each other.
Dr. Ben then prepares to put Curtis into a coma with 2 injections, a sedative and a paralysing agent.
BVM.
Yeah, on.
End-time.
End-time's on, reading at 3.0.
BP systolic.
The last systolic was 127.
And cycle set.
Cycle set every 3 minutes automatic.
Saturations. Okay, drugs going in now. Okay, fentanyl's in. Ketamine is in.
Okay, everybody ready? Okay, so oxygen mask is coming off. Okay, there's no loose teeth that we've seen. So, got the blade, and I'm going to open his mouth as wide as I can.
We're going to go for the video
scope we've got
first.
Video scope first, with a size 4 blade. Okay, we've got a backup of a Mach 4.
Yeah.
Batteries checked, charging.
Okay.
A laryngoscope A camera with a screen allows Pete to look into Curtis's airway for obstructions.
I'm going down the right-hand side of his mouth, sweeping the tongue to the left, and I'm going to walk down as I go and looking for landmarks. I've got the epiglottis, but... OK, a bit of suction, please.
Suction.
There's quite a lot of phlegm at the back of his throat. OK, I've got a grade 1 view there, I can see the cords.
With a clear path, the breathing tube can be inserted into the trachea.
OK, I think through the cords and the black line, we are 22 at the teeth, Ben. OK, we've got misting of the tube. OK, I'm coming out with the blade. Cheers, thanks.
Curtis is now in an induced coma and breathing with the aid of a ventilator. Dr. Ben and the ambulance crew have done all they can.
It's nice and steady, buddy.
The importance of our services, we're bringing some of the emergency department to the patient rather than the patient having to wait to get to the emergency department. He's been anaesthetised a lot faster by us getting a doctor quickly to scene, so we've saved him some time and hopefully improved his outcome that way.
Hello? I've had a car crash, please, someone else.
Okay, are you injured?
Yeah, really bad, yeah.
Okay, all right, listen, what's the address? Where are you?
I don't know.
Ask somebody to help you.
I can't, I'm in the middle of the road.
Okay, are you out of the car?
Yeah, the car's in the tree.
The car's in the tree?
Yeah, but my brake trapped.
How many people are in the car?
3.
We found you, my love. Okay, stay on the side.
I think I broke my back. Ow! Ow! Ow!
4 ambulances, multiple police units and 2 fire engines have been called to the site of the crash.
Mike Delta 98 on channel, leaving QE now.
Critical care backup is also urgently required, so Richard and Ian need to get there fast.
Got 1 male, 2 females, still trapped in the vehicle. One's possibly got an impalement injury on a tree tip.
Hi Delta 98, that was all copied. Our ETA is approximately 3 to 4 minutes over.
With multiple casualties, this is a major incident, requiring all the emergency services to work together to save lives. On arrival, they are briefed by West Midlands Ambulance Tactical Incident Commander Tim, who is coordinating the whole emergency effort.
So we've got 1 patient that's been ejected on this ambulance here. We've got 3 more in there. 1 has just been dragged out, a male patient. We've got some concerns over his airway. We've got 2 more patients in the back. They're lying on top of each other at the moment, so we're just trying to get a plan to get them out.
Okay.
The 4 friends were returning from a restaurant when the car lost control before hitting trees and landing on its roof. 1 female passenger in her 20s was ejected from the vehicle and has just been moved onto the ambulance.
If one of you can have a quick look, because they're pretty much packaged and they can get going.
Okay, right. Have a quick eye on this one? Yeah.
If you could also look at the chap that they dragged out that's potentially got airway.
Yeah. Hello guys, you all right?
How you doing? You okay?
Hello. What have we got? Very quickly.
The patient on the ambulance is the woman who called 999. She is complaining of severe back pain. She is also bleeding from a head injury.
Jack, very quickly, patient 1 is the ejected female, is a GCS 14/15, good bilateral radials, moving all 4 limbs. We'll get the crew to ring you when they're ready to go with an atlas for Worcester, okay?
With her spine immobilised, Ian and Richard decide that she is stable enough to be taken to hospital.
Right, that's patient 1.
An ambulance crew prepare to take her, leaving the critical care team to assess the rest of the crash victims.
That one's going to Worcester. You want to just have a look at the one that's been dragged out?
Yeah, if you don't mind.
Where are they? Just point us.
It's this person in the green shirt on the floor here.
Go look over here, okay. What have we got?
The driver, a man in his 40s, is in a much more serious condition.
Is he speaking to you at all? Just about, yeah.
He was pulled from his seat by the ambulance crew and is now on a stretcher and only semi-conscious.
This chap dragged out. He was not able to be laid flat at all. Okay. Started to put back roll to his side. Quite a lot of blood coming back in his airway. Okay, so I'll just get around that way. We'll just scoop him on his side if that's where he'll be.
Can you open your eyes, my friend? Where's your worst pain? In your chest. Are you happy on your side or lying on your back?
As Ian and Richard try to assess his injuries, screams are heard from the wreckage of the car, where the other 2 passengers are still trapped.
Can you lift this leg for me?
The driver is on the ground, semi-conscious. The full extent of his injuries is still unknown.
At the minute he's talking, he's able to speak. He said he's got pain in his chest and he wants to go onto his back. He's quite cold, but we'll just get him on his back and get him off. Have a look from there. There you go, just roll onto your back, my friend. Go onto your back, there you go.
With the help of the fire brigade, the man is rolled over.
Guys, are you okay just to give hands and we'll lift him straight on the stretcher?
He's bleeding from a wound to his head.
On the, You stay there, bro. We're going to get you on the ambulance, okay? Right up.
One female passenger in her 20s has already left the scene in an ambulance. The remaining 2 passengers are still trapped in the back of the car.
How you doing? Okay.
Given the high number of casualties, extra resources have arrived.
First casualty that was ejected, we just had a quick once over the ambulance. She's received trauma tool negative, so we said Worcester for her.
Ian and Richard will focus on the driver, leaving the West Midlands care team to take over the trapped passengers when they are freed.
This chap, they've also got out. They were concerned about his airway, but he's talking. So doing another assessment now that he's on the trolley. And there's 2 people still in there that are trying to get out. So we've not had any eyes on them, but the heart team are in there trying to get them out.
The Hazardous Area Response Team are specialists trained to extricate and treat patients in dangerous situations. The fire brigade and ambulance crew are working against the clock to free the 2 remaining female passengers. One woman is bleeding from her head. An hour and 8 minutes after the 999 call, the last 2 patients are brought out of the wreckage and are on their way to receiving emergency treatment. On board one of the ambulances, Ian has had the chance to examine the driver, and his condition is deteriorating. He needs to get to hospital fast.
If you get to the point we want to intervene further, we'll just give you a shout, pull over, jump on in the back, and then we'll go from there. Is that all right? Okay.
Happy? Yeah. Yeah.
Ian and Richard will travel with him to provide continual care throughout the 20-minute journey.
So it's a male, we think in his late 40s. Injuries-wise, it looks like he's definitely got maxillofacial fractures and possible head injury as well. He's got a black eye on the right with a very swollen, deformed right cheek. His GCS was 13 and he's a bit agitated. So query head injury. He's been cannulated and he's had some ketamine sedation, a total of 40 milligrams so far.
Arriving at hospital, Ian and Richard deliver their critically ill patient to the waiting emergency doctors.
So it's quite a different job, that from what you're probably used to dealing with. So significant ITC with quite a few patients.
After a complex multi-service job, everyone can take stock and learn valuable lessons for the future.
It's very important, so particularly that job where there's lots of people there working and lots of things going on. It's quite useful to, at the end, go through what happened at the job, what we did, what could have been done better, and it's quite useful for the crews, for their learning, because most of the regular ambulance crews don't go to jobs like that very often at all, probably once a year if that.